The storm hit Callaway Bay like a punishment. 6 Army Rangers bled out on gurneys while the lights flickered, and every surgeon in the building was either trapped across town or already in surgery. The hospital director stood in the middle of the emergency room, looking at his staff one by one, and every single one of them looked away. Everyone except the quiet ER nurse in the corner. The woman he'd spent 3 years treating like she was furniture. He pointed at her the way you'd point at a last resort. She didn't flinch. She didn't beg. She just looked at the dying soldiers and made a decision that would unravel everything he thought he knew about who was really running this hospital. Before we go any further, if you've never been to this channel before, hit that subscribe button right now and turn on notifications, because the stories we tell here don't pull punches. Every week we bring you the kind of cinematic drama that stays with you long after the screen goes dark. Hit the like button if you're already hooked, and drop a comment below telling me what city or country you're watching from. I want to see how far this story travels. Now, let's go back to that emergency room. The rain had been building since noon, the kind that started politely and then turned mean, the kind that coastal towns like Callaway Bay knew better than to ignore. By 6 in the evening, the weather had graduated from inconvenient to dangerous, and by 7:15, when the ambulances started arriving at Garrison Point Medical Center, the storm had become something else entirely. A wall of wind and water that had knocked out a transformer 3 miles east of town and turned the Bay Road into a river. Margaret Mara Ellison was charting at the triage desk when the first call came in. She heard the radio crackle, heard the dispatcher's voice cut in and out with the interference the old radio system had been throwing for months, and caught fragments, multiple casualties, trauma, military personnel, ETA 4 minutes. She set down her pen. Around her, the ER was already in the particular kind of controlled chaos that happened when a storm moved in. Sprained ankles from people who'd slipped on wet pavement, a man with a head laceration from a tree branch, 2 kids who'd been in a minor fender bender on the coast road. Manageable. Routine. 4 minutes later, nothing was routine. The ambulance bay doors burst open and the paramedics came in fast, 2 gurneys at a time, and behind them came men who shouldn't have been in any hospital at all. Army Rangers, 6 of them. Whatever they'd been doing 20 miles south of Callaway Bay, and nobody had explained that yet. Nobody had explained anything. It had gone wrong in the kind of way that left people in pieces. Mara was on her feet before the first gurney cleared the doors. She'd been an ER nurse for 11 years. She knew what catastrophic looked like, and this was it. The first soldier had a chest wound that was working against him with every breath he took. The second had lost significant blood from a wound to his upper thigh, the tourniquet applied in the field the only reason he was still conscious. The third was unresponsive, one pupil blown, the other tracking poorly, which told her everything she needed to know about what was happening inside his skull. The fourth and fifth were critical but stable in the way that meant they were one wrong move away from not being stable at all. The sixth, the one they brought in last, the one the paramedics spoke about in low, tight voices, had a chest that wasn't moving right, and his color was the kind of gray that made experienced nurses go cold. "Where's Dr. Ashfield?" Mara called out, already moving toward the first gurney. "Operating," someone said. "Has been for 2 hours." "Kavanaugh?" "Still across town. The Bay Road's flooded. He can't get through." She turned. "Simmons? Nakamura?" The charge nurse, Doreen Park, met her eyes. Doreen had been in emergency medicine for 20 years, and she did not rattle easily, but she looked rattled now. "Simmons is in OR2. Nakamura got the call an hour ago, and he's been trying to get here, but the storm—" She stopped. "Mara, we don't have a trauma surgeon in the building." The room kept moving around them, nurses cutting clothes away, techs setting up IV lines, monitors screaming their alarms. But Mara felt the pause, the way everything sort of held its breath for one beat. 6 critically wounded men. No surgeon. A storm that had effectively sealed the hospital off from anyone who might have been able to come. She was already calculating, not because it was her job to calculate, because she couldn't help it. It was something that had been wired into her a long time ago, in places and circumstances she didn't talk about anymore, and no matter how many years she'd spent trying to just be a nurse, trying to just do her job and chart her patients and go home, the other thing, The things she'd buried never went entirely quiet. "Get me 4 nurses, 2 techs, and call the blood bank," she said. "Type and cross everyone coming in. And someone get on the phone with the state surgical coordinator, because we need a helicopter, and we need one now." She was 3 steps toward the trauma bay when the doors at the far end of the corridor swung open and Director Philip Garrett walked in. Garrett was a big man, not physically, but in the way he occupied space, in the way he moved through a room like he expected it to reorganize itself around him. He was 61 years old, had an MBA from a school he mentioned frequently, and had run Garrison Point Medical Center for 7 years without ever, as far as Mara could tell, having been inside an actual trauma room while something real was happening. He had a talent for arriving after the crisis and calling it supervision. He wore a tie even now, even in the middle of the storm, and his shoes were dry, which meant he'd come through the administrative entrance. He looked at the gurneys, he looked at the monitors, he looked at the staff moving with the concentrated urgency of people who understood exactly how bad this was. Then he looked at Mara. "Where are the surgeons?" he said. "Unavailable." She kept moving. "I've called the surgical coordinator. I didn't ask what you've done. I asked where the surgeons are." She stopped, turned to face him, because she'd learned the hard way that letting Garrett talk to her back was never as efficient as it seemed. "Dr. Ashfield is in OR1. The road's flooded. We can't get anyone else in the building right now." Garrett's jaw tightened. He looked at the soldiers again, really looked at them, for maybe 2 seconds. And then he looked back at Mara with the expression he always wore when he was deciding who to be in a given situation. "You're a nurse," he said. "Get the patient stable and wait for a real physician to arrive." It was not the worst thing he'd ever said to her. That was the honest truth. Over the 3 years she'd worked at Garrison Point, she had been told by Philip Garrett, in various configurations of the same essential message, that her concerns were overblown, her recommendations were outside her lane. Her observations about equipment failures and supply shortages were the product of a nurse who didn't understand how hospital administration worked. He had said these things in front of colleagues, in front of patients, in one memorable instance, in front of a group of medical students who had very carefully not looked at her. She had learned to absorb it. She had learned because the alternative was leaving, and she wasn't willing to leave. "Director Garrett," said Dr. James Whitfield, one of the ER attendings who'd been on shift when the ambulances arrived. He was young, 34, sharp, the kind of physician who actually listened when nurses talked. "We have a tension pneumothorax in Bay 2 and a severe TBI in Bay 3. If we don't act in the next few minutes, then call a surgeon." "There are no surgeons available, sir. That's the situation we're in." Garrett pointed at Mara. "Then she can stabilize them until someone qualified gets here. That's what nurses do." Mara looked at him for a long moment. She thought about a dozen different things she could say. She chose none of them. "I'll do what I can," she said, and turned toward the trauma bay. What she didn't say was that she'd been doing what she could since before Philip Garrett had ever heard of this hospital. Bay 1 held the soldier with the chest wound, a ranger whose dog tag read Del Vecchio, late 20s, muscular in the way men got when their fitness was professional necessity rather than preference. The field medic had done good work. The wound was packed, the tourniquet placed correctly. But packing only bought time, and time was what they were running out of. Mara examined him quickly, her hands moving with a precision she didn't think about anymore, because she'd done this 10,000 times, in conditions that made a hospital ER look leisurely. "Talk to me," she said. He blinked at her. His voice was thick. "Where am I?" "Garrison Point Medical Center, Callaway Bay. You're safe." She was already checking his breath sounds, noting the diminished entry on the left, the increasing respiratory distress. What happened? Training op went sideways. Weather came in faster than... He coughed, and the pain of it showed on his face. The others okay?" "Working on it. Stay still." She straightened up and found James Whitfield at her shoulder. He was watching her hands with an expression she recognized, the look of someone who was seeing something that didn't quite fit the category they'd put her in. "What are you thinking?" he asked. "Left hemopneumothorax. He needs a chest tube." She moved to the next bay before he could respond, because she already knew what he was going to say, which was that chest tubes were a physician procedure and she was going to have to deal with that conversation in approximately 30 seconds. The soldier in Bay 3, Morrison, according to his tag, was the TBI. Unresponsive, posturing on the right side, the blown pupil she'd noted on arrival even worse now. His blood pressure was climbing while his heart rate dropped, and that particular combination had a name, Cushing's triad. And it had only one meaning, which was that the pressure inside his skull was reaching the point where the brain stem was about to stop functioning. She had maybe 10 minutes, possibly less. She pulled Whitfield aside. Her voice was quiet and direct. Morrison needs emergency decompression, burr holes. If we wait, he dies. The man in Bay 1 needs a chest tube in the next 5 minutes, or he arrests. Bay 6. She'd already looked at Bay 6, the gray-faced soldier they'd brought in last, the one with the abnormal chest movement. Bay 6 has a cardiac tamponade. He needs a pericardiocentesis. Whitfield stared at her. Mara, I know. I know what they are. He was quiet for a moment. Around them, the monitors kept screaming, and somewhere down the hall, a nurse was calling for more blood products, and the lights above them flickered once. The emergency generators kicking in as the main power stuttered. And in that flicker, in that 1 second of half-darkness, Whitfield looked at her in a way that was different from how he'd looked at her this morning, or yesterday, or any of the days he'd known her. Where did you train? He said. She held his gaze. We don't have time for that right now. She went to Bay 6 first because cardiac tamponade killed fastest. The soldier there was barely conscious. A big man, probably the team leader based on his gear, older than the others, late 30s maybe. A face that looked like it had been through a few things, even before tonight. His name on the dog tag was Rollins. His blood pressure was in the 70s and his neck veins were distended and his heart sounds were muffled in the way that meant fluid was compressing the heart from outside, squeezing it, preventing it from filling properly. She explained what she was doing as she set up. Not to Rollins, who wasn't fully tracking, but to the nurse beside her, Tessa Kwan, who was 26 and competent and clearly working very hard to keep her face neutral. Pericardiocentesis. I need a long-gauge spinal needle, a 10 cc syringe, and ultrasound guidance if the portable's free. Mara, Tessa said quietly. Garrett, I know where Garrett is. He's right outside. I know. She felt for landmarks, oriented herself by anatomy the way she'd been taught a very long time ago by people who didn't have the luxury of hesitation. What's the ultrasound situation? Coming? Tessa turned and called for it, and it arrived in 30 seconds, pushed in by a tech who looked like he was watching something he wasn't sure he should be watching. Mara positioned the probe, found the pericardial effusion immediately. The fluid was clearly visible, surrounding the heart like a dark halo. And then she picked up the needle. Behind her, the door to the trauma bay opened. What is she doing? Garrett's voice. Nobody answered him. Mara didn't turn around. Someone tell me what is happening in this room right now. Whitfield spoke. She's performing an emergency pericardiocentesis. She's a nurse. The patient will die without intervention, Director. Then we wait for there's no one else. Whitfield's voice was careful but firm, the voice of a man who'd made a decision and was committing to it. We wait and he dies. That's the math. Silence from Garrett. Mara was already working, needle in, advancing slowly, watching the ultrasound screen, feeling for the right moment. When the fluid came back into the syringe, dark and venous, she drew it off systematically, watching the heart on the screen begin to move differently, begin to fill, begin to do what hearts were supposed to do. Rollins' blood pressure started climbing, 60, 72, 84. His color changed. He opened his eyes, he looked at her, and he said nothing, just looked. But the way he looked at her was the way people looked when they knew they'd just been brought back from somewhere they weren't supposed to come back from. She capped the needle and moved without pausing. Bay 1, chest tube, now. Garrett was in the doorway. She walked past him like he was a piece of equipment someone had left in the wrong place. He reached out and caught her arm. I will have your license, he said. You understand that? What you just did in there is the reason that man is alive. She removed his hand from her arm, not roughly, just removed it. You can file whatever report you want, Director. Right now I have 5 more soldiers who need me. She met his eyes, and whatever he saw there made him step back without quite meaning to. Get out of my way! She was already moving. Paredes had been holding, that was the thing. He'd been holding for 2 hours on the strength of 2 tourniquets and 4 units of blood, and the particular stubbornness of a young man who'd decided he wasn't going to be the one who didn't make it. Then something in the vascular architecture that the tourniquets had been containing finally shifted, the way things that have been under pressure long enough eventually shift, and his systolic dropped to 64 in under 3 minutes. Mara hit the bay at a run, which was not something she did often because running in a trauma corridor communicated panic to everyone who saw it. But there was no one to manage right now, no perception to control, just Paredes on the gurney with his skin the color of old wax and his pressure in the basement and the monitor screaming the way monitors screamed when they were telling you something you already knew. Second large bore IV, right antecubital, she said, already at the bedside. Pressure bag on the saline. Get me the remaining ONEG and tell the blood bank I need whatever they have left, any type. She was assessing him with her hands and eyes simultaneously, checking the tourniquets, both still correctly positioned, no visible failure, which meant the problem was proximal. The bleeding was happening above the tourniquet's reach, somewhere in the pelvic or iliac vessels where no tourniquet could go. Tessa was beside her, moving fast and clean. Both units from the Mercy transfer are already up. I need more than 2 units. She pressed on Paredes' abdomen, rigid, distending, the involuntary guarding of a belly filling with blood. Pelvic fracture, probable iliac vessel injury, which was the kind of vascular emergency that killed people in operating rooms with full surgical teams and the right equipment, let alone in an emergency bay in a coastal hospital during a storm. She did the math quickly, the brutal, unsentimental arithmetic of trauma, and the math said that Paredes had maybe 20 minutes before the volume loss became irreversible. Paredes, she said, can you hear me? His eyes found her. The focus was soft, fading at the edges. Yeah, he said. His voice had changed, thinner, the effort of it visible. Yeah, I hear you. I need you to stay awake. Keep talking to me. Is it bad? She didn't lie to patients. She also didn't tell them things that wouldn't help. We're working on it. What's your first name? Diego. Diego, how old are you? 23. 23. She registered it and set it down in the place she put things she couldn't feel right now. You have family? Mom, 2 sisters. A pause, the pause of effort. Corpus Christi. Tell me about them. Keep talking. She was doing 2 things at once, managing his resuscitation, calculating his volume, adjusting the pressure bags, while he talked about his mother's kitchen and the sister who'd just started college, and the dog they'd had when he was 9, a brown mutt named something she didn't catch over the alarm noise. She listened to the words the way she always listened when she needed a patient to stay present, not to the content, but to the rhythm, the strength of the voice, the small, incremental changes that told her whether they were tracking or fading. Whitfield appeared. He took one look at the monitor, one look at Paredes' abdomen, and looked at Mara. REBOA? He said. It was not a suggestion. It was the question of a physician who'd just done the same math she'd done and arrived at the same place. REBOA, resuscitative endovascular balloon. Occlusion of the aorta was a procedure used in trauma centers to buy time for exsanguinating patients when surgery wasn't immediately available. You threaded a catheter up through the femoral artery and inflated a balloon in the aorta to reduce blood flow to the injury site, buying the patient time that the laws of physiology would otherwise not allow. It was not a beginner procedure. It required specific training, specific equipment, and a specific kind of experience that most emergency departments, even large ones, did not regularly maintain. Mara had done 43 of them in her previous life. She had written the training module used by 2 branches of the military for field-expedient aortic occlusion. She had not done one in 4 years. Do we have the kit? She asked. Storeroom, unopened. We got it last year as part of the trauma equipment upgrade. It's never been used. She'd advocated for that equipment. She'd been the one who'd put it on the procurement list and followed up 3 times before it was approved. and Garrett had approved it not because he understood what it was, but because the state trauma certification required it for Level 2 designation, and the designation affected reimbursement rates. She'd known at the time that she might need it for exactly this kind of reason, and she hadn't known then whether she'd be the one using it. "Get it," she said. Whitfield went. Tessa was already adjusting the drips. Paredes had gone quieter in the last 90 seconds, not unconscious, but the words coming less easily, the voice dropping in the way that happened when the body started redirecting resources. "Diego," she put her hand on his forearm. "Stay with me." "I'm here," he said. His eyes were working to stay focused. "Is my team okay?" "Your team is here. They're being taken care of." "Rollins?" "Awake. Stable." Something in his face eased slightly, enough that she could see it. "He never goes down easy," he said, almost a smile. "Neither do you," she said. "Keep that up." The Reboe kit arrived, and she opened it with the efficiency of someone who'd opened this specific packaging or its equivalent many times, her hands taking over the muscle memory while her brain stayed with the overall picture. His pressure, his rate, the clock on the wall reading 12:57, the neurosurgeon for Morrison due in 90 minutes if the weather window held, Okafor still holding but declining, Delvecchio stable, Rollins now needing closer cardiac monitoring after the lidocaine. She was halfway through the access procedure when Garrett walked in. She had thought, honestly, that he was done for the night, that he'd retreated to his office and his legal team and was content to document and threaten from a distance. She had underestimated his need to be physically present at the moment of maximum control. "Stop," he said. Nobody stopped. The room kept moving. "I am ordering a halt to this procedure." His voice was tight, the voice of a man who decided this was the moment and was committed to it. "This individual does not have surgical privileges at this institution. Any further invasive procedures constitute criminal liability for this hospital and for every staff member who assists. I want this room cleared of everyone except licensed physicians immediately." Tessa did not move. Neither did the tech on Paredes' other side, a young man named Felix who'd been working this bay all night and whose hands had not shaken once. Whitfield turned around. His voice was very quiet. "Director Garrett, this patient will die in approximately 15 minutes without this intervention. I am the licensed physician in this room, and I am authorizing this procedure. You don't have the authority to. I'm the attending on shift. In the absence of senior surgical coverage, I have operational authority over patient care decisions in this bay. That's in the medical staff bylaws, Section 4, Paragraph 2. Whitfield had clearly looked this up at some point in the last hour, or had known it all along. And either way, he was using it now with a precision that Mara noted and filed. "If you'd like to discuss the institutional policy implications, I'm available after this patient is stable. Right now, I'm asking you to leave this bay." Garrett did not leave, but he didn't issue another order either, which was its own kind of capitulation, even if he didn't know it yet. He stood at the edge of the room like a person who'd expected something different to happen, and was recalibrating. Mara completed the access. The balloon inflated. The pressure on Paredes' monitor began, grudgingly, to respond. 68, 71, 77. Not normal. Not safe. But better. Buying the time she'd known it would buy. Buying the window they needed. "Diego, she said. "Yeah." His voice was still thin but more present. "Yeah, I'm here. We bought you time. There's a surgical team coming. You need to stay as still as you can." "Did you just—" He stopped, collected himself, tried again. "Did you just go into my aorta?" "Yes." A pause. "That's intense." "It is," she agreed. And she meant it. She was pulling off her gloves when she noticed Garrett had taken out his phone and was photographing the bay, the equipment, the procedure setup, her. And something about that, about the deliberateness of it, hit her differently than everything else he'd done tonight. The documentation wasn't for patient safety. It wasn't for institutional record. It was evidence collection, the kind of evidence you collected when you were building a case against a person. And he was doing it in full view of the patient and the staff and the room, with the confidence of someone who believed he had already won the argument he hadn't finished making yet. Mara looked at him across the bay, and he looked back at her, and in the silence between them was a very old dynamic. The person with institutional power and the person without it. The person whose name was on the building versus the person whose name was on no buildings at all. And he was smiling, barely, the smile of a man who understood how institutions worked. She turned back to Paredes and checked the balloon position. At 1:18 in the morning, the neurosurgeon arrived. Dr. Patricia Sable came through the rooftop access with two members of her team, carrying her own equipment, shaking water off her jacket with the brisk efficiency of someone who'd flown through rough weather enough times to have lost patience with being impressed by it. She was mid-50s, compact, with the kind of focus that took up space differently than physical size. She went directly to Morrison's Bay, and Mara walked her through everything: the timeline, the interventions, the current status, and Sable listened with her eyes on the patient and asked 3 questions, all of them precise, and then she said, "All right," and turned to her team, and that was that. Watching Sable work was something Mara allowed herself for about 90 seconds before she turned back to her own remaining problems. Okafor needed a surgical consult. Sable's team included a general surgeon, which was a circumstance Mara had not anticipated, and which changed Okafor's prognosis in a significant and measurable direction. She introduced herself to the general surgeon, a younger man named Dr. Torres, who had the nervous competence of someone still proving himself, and she walked him through Okafor's situation with the same precision she'd used with Sable, and Torres said he'd take a look, and she told him to do more than look. It was while she was updating charts at the nurse's station at 1:35 that Rollins called for her again. He had stayed in his bay this time, progress, she thought, though she suspected it was strategic rather than compliant. When she came in, he was sitting up, which was still not what she'd have prescribed, but was at least contained to the bed, and he had his dog tags in his hand, turning them over. A fidget or a habit. She didn't ask. "Your surgeon," he said. "The one who flew in. She's from Harwick Regional Trauma Center." "Yes. Harwick is where they transferred 3 of our casualties 3 years ago, after an operation in the Kestrel Mountains." His voice was level and factual. "We lost 2 on the table. We almost lost a 3rd. The 3rd survived because of a procedure the surgical team had never done before, an emergency resection and vascular reconstruction under field-equivalent conditions, improvised from a protocol that had been developed for exactly that kind of injury." He looked at her. The protocol was written by a surgeon who'd been embedded with a Ranger battalion for 14 months. Mara said nothing. The surgeon who wrote that protocol was identified in 2 after-action reports as Major Margaret Ellison. He waited. "Nobody calls you Margaret, I'm guessing." The station monitors were beeping. Down the hall, Torres was in with Okafor. The clock above the door read 1:37, which meant she'd been on shift for 11 hours, which was 3 more than her scheduled rotation, which nobody had had time to address. She sat down in the chair across from his gurney, which was something she didn't do often. Sitting implied time, and time was the thing she never had. But she sat, and she looked at him, and she made a decision that she'd been not making for 4 years. 8 years active service, she said, surgical subspecialty, 14 months with the 75th, then 2 years with a joint special operations medical unit I'm not going to name. I left in 2021. She paused. "I had reasons." "I know some of them," he said quietly. She looked at him. "What do you know?" "Kestrel Mountains, November 2020. He held her gaze. "I was the battalion commander on that operation." The room shifted slightly, not physically, but in the way rooms shifted when the shape of a conversation changed. She looked at Rollins, really looked at him, the way she hadn't let herself look when she'd been focused on the pericardiocentesis and the rhythm strip and the 10,000 things she'd been managing. And she found the face she'd thought she didn't recognize was in fact a face she had, but in different circumstances, in different lighting, in the context of a night that had gone wrong in ways that still turned up in the part of her sleep that wasn't really sleep. "You were awake before the surgical phase," she said. "I was. I've read all the reports since." He set the dog tags down on the blanket. "You stayed in that operating tent for 19 hours. 2 of my men didn't make it. The 3rd one is currently a staff sergeant at Fort Bragg with a wife and a kid and a fully functioning left leg that he's kept because of what you did." He stopped. "That's not why I joined the Army. Carrillo joined because his dad was a soldier. He's got a daughter named Rosie. I got to meet her last year. Another pause. I'm telling you that because you should know it, not because it changes what's happening tonight. She didn't look away. What is happening tonight? A hospital director is building a case to end your career, he said, based on the fact that he doesn't know who you are, and you're letting him. I'm not letting him do anything. I'm managing my patients. You could tell them. I could. She was quiet for a moment. I've kept this private for 4 years. There are reasons for that too. I know there are. He didn't push it. That restraint, the choice not to press when he clearly could have, said something about him that she hadn't previously had context for. What I'm telling you is that my men have been recording since we deployed. It's mission protocol, continuous audio, encrypted transmission to the unit's data server. He looked at her steadily. Everything that's happened in this building tonight is on record. She felt the weight of that settle. Not relief exactly, something more complicated. That's not my decision to use. No, he said. It's mine. At 2:04 in the morning, Philip Garrett walked to the center of the nurses' station and announced, loudly enough for the entire trauma corridor to hear, that effective immediately Mara Ellison was suspended from clinical duty pending emergency review, that her access to patient records and medical supply systems was being terminated, and that any staff member who assisted her in patient care activities from this point forward would be subject to disciplinary action. The corridor went quiet. Not the normal quiet of a settled night. They were nowhere close to that, but a specific quality of silence that happened when something that had been building reached the moment it became undeniable. Tessa stopped what she was doing. Doreen looked at the station wall. Felix, who'd been updating the supply cart, held very still. Whitfield came out of Morrison's Bay and stood at the far end of the corridor and looked at Garrett with an expression that had moved past conflict and into something cleaner and colder. Mara was at the central workstation updating Paredes' chart. She finished the line she was writing. She saved the document. She stood up. She looked at Garrett. Then she looked at the corridor, at the people in it, the staff she'd worked alongside for 3 years, the people who'd been in those bays with her all night. And she looked at Paredes through the bay window, the balloon still in place, his pressure holding at 88. And she looked at Okafor, where Torres was doing his assessment. And she looked at Del Vecchio, who was awake and watching through the glass. And she looked at Bay 6, where Rollins was not visible but was present in the way she'd become aware of all evening. Okay, she said. Garrett blinked. He'd expected something else, argument, or justification, or the specific kind of institutional deference he usually got when he used that voice. You'll surrender your access badge and I'll hand off properly, she said. Paredes is on Ariboe with a critical window. I need to brief whoever you're putting on him. Okafor is an active surgical evaluation. Morrison is with the neurosurgeon. I'll give you 15 minutes to put a physician on each bay and then I'll step out. She picked up her badge from the lanyard around her neck and held it out. Not through it. Held it out steady, the way you handed something to someone when you wanted them to understand exactly what they were taking and why. Who's taking Paredes? Garrett took the badge. He looked briefly like he didn't know what he'd expected, but it wasn't this. Whitfield, he said. Then I need 10 minutes with Whitfield. She spent 9 minutes with Whitfield and 1 minute with herself. In the supply room off the main corridor, the door closed, the noise of the building muffled. She put her hands flat on the shelf in front of her and breathed once, fully, and then she straightened up and rolled her neck and went back out. She was in the corridor, moving toward the exit as she'd agreed, when every light in the building went out. Not a flicker this time, not the stuttering hesitation of an overtaxed system. All of it, simultaneously, the full load. Overheads, monitors, panel lights, the glow from the workstations, gone. And in the sudden total dark, the only sounds were the mechanical fade of the ventilators switching to battery backup and the sharp, terrible silence of the cardiac monitors losing power before the emergency system caught them. 4 seconds of darkness. The red emergency lighting came on, low, directional, the bare minimum. And from Bay 2, from Del Vecchio's Bay, from the soldier who'd been stable for the past 2 hours with his oxygen saturation in the 90s, and his chest tube draining and his blood pressure climbing back towards something that looked like survival, came an alarm that cut through everything else. Not a monitor alarm. The ventilator. The chest tube had shifted in the power transition, dislodged by some combination of his movement and the abrupt equipment failure. And the lung that had been re-expanding for 2 hours had just lost the drainage that was keeping it open. Mara stopped walking. She turned around. Garrett was 10 feet away, her badge still in his hand, watching her with the alert stillness of a man who understood that something had changed but didn't yet know what. "Del Vecchio," she said to no one in particular, and then she was moving back into the corridor, back toward the bay, back toward the alarm. Her suspended credentials and the signed-off handover, and the 10 minutes she'd spent making peace with leaving all of it becoming irrelevant in the way that everything became irrelevant when someone in front of you was about to stop breathing. Garrett called after her. She didn't hear what he said. She was already through the bay door when the alarm changed pitch. Higher, faster, the sound of a chest that was collapsing again. The sound of all the work of the past 3 hours beginning to undo itself. And she hit the light on her pen light and got her hands where they needed to be and found what she'd known she'd find, the tube displaced, the seal compromised, the left chest filling again with air that had nowhere to go. "I need a thoracic tray," she said. "Now. Red emergency light bay 2. No one moved for 1 second. The suspended order still in the air, Garrett's voice still echoing somewhere behind it. And then Tessa moved, and Felix moved, and Doreen was already on the phone, and the tray was coming. Mara worked by penlight and emergency red, her hands doing what they'd always done, what she'd spent 11 years and 8 years before that training them to do. And she did not think about the badge that was in Garrett's hand or the review that was waiting or the 4 years she'd spent building a version of herself that didn't have to be this particular person anymore. She thought about Del Vecchio's oxygen saturation. She thought about Diego Paredes in the next bay with a balloon in his aorta. She thought about Morrison upstairs with Sable's hands inside his skull. She thought about Rollins, watching from bay 6, recording. She got the tube repositioned. She got the seal reestablished. She got the suction running again on the battery backup pump that Decker had kept operational when he'd shed the non-essential loads. Del Vecchio's saturation began to climb. And in the doorway, behind Garrett and beside the legal team representative, who was writing something on her clipboard, stood a man in a military service uniform who had not been in this building an hour ago. He was not in scrubs. He was not staff. He was standing with the particular stillness of someone who'd been listening for a while before anyone noticed him. He looked at Mara. He looked at Garrett. He looked at the badge in Garrett's hand. And he said quietly, but with the kind of authority that didn't need volume, "I'm going to need everyone in this corridor to stay exactly where they are." The chest tube for Del Vecchio took 11 minutes, longer than she wanted, because the equipment on the cart was not what she'd have chosen and the lighting in Bay 1 was working against her, one of the overhead fixtures buzzing and dimming with the generator fluctuation. But she got it placed, got it draining, and within 4 minutes, his oxygen saturation was climbing and his respiratory distress was easing, and he was looking at her with the dazed focus of someone whose body had just remembered how to breathe correctly. "That's it," she told him. "Just breathe, don't talk." "You're not a doctor," he said. "No." "You just put a tube in my chest." "Yes." He considered this. "Okay," he said, which under the circumstances was a remarkably reasonable response. She was halfway to Bay 3, to Morrison, to the TBI that had been building pressure for the past 20 minutes, and was now reaching the point where every additional minute was permanent damage. When she heard Garrett on the phone in the corridor, she couldn't hear everything. She caught enough. Liability. Documentation. Unauthorized procedures. Suspend immediately. She kept moving. Tessa Kwan fell into step beside her. "He's calling legal." "I figured." "Mara." Tessa grabbed her elbow, not stopping her but slowing her, enough to say what she needed to say. "Morrison's been down 15 minutes with those signs. You know what the outcome is, statistically, even with the intervention." "I know the statistics. I want to make sure you—" "I know." She stopped for 1 second, looked at Tessa directly, because Tessa deserved that. "I know the numbers. I also know that he's 24 years old, and I haven't tried yet." She held Tessa's gaze long enough for the message to land, and then she was moving again. The emergency decompression was the hardest thing she'd done in years. Not technically. Technically, her hands did what her hands always did, which was to perform with the kind of reliability that came from repetition so deep it had become reflex. What was hard was the room. The nurses present had all worked with her for months, knew her as a colleague, as the one who filed the safety reports that Garrett ignored, as the one who brought in lunch for the overnight staff, and remembered everyone's kids' names, and always stayed late when the shift got bad. They didn't know her as this. She could feel them recalibrating in real time, and she didn't have the bandwidth to manage that and also do what needed to be done, so she let them recalibrate and focused on Morrison. The drill was a piece of equipment that should have been upgraded 18 months ago. She'd written that in a report that had gone nowhere. And it fought her slightly, and there was a moment, one moment, when her jaw tightened and she breathed once through her nose and then kept going. When she felt the resistance give and the pressure release began, the monitors showed the first tentative improvement in Morrison's posturing. Not resolution. Improvement. She stepped back. Let Whitfield take over monitoring. Rolled her neck once, a small private thing, and looked at the remaining patients. Outside Bay 3, she became aware of two things simultaneously. The first was that Garrett had come back with two people from administration and was standing at the nurses' station making notes and speaking in the tight, controlled voice of a man building a case. The second was that in Bay 6, Rollins, the team leader, the one she'd drained the tamponade from, the one who'd been barely conscious when she arrived, had propped himself up on his elbows and was watching her through the glass partition with an expression she couldn't quite read. Not gratitude. Something more complicated than gratitude. Recognition, maybe? Though that made no sense because she'd never met this man in her life. Or she didn't think she had. She crossed to the nurses' station to update the charts because documentation existed and mattered even in the middle of catastrophe, maybe especially in the middle of catastrophe. And as she passed the corridor intersection, she heard Garrett say her name to one of the admin staff. Clearly. Not accidentally. The way people said names when they wanted you to know you were being talked about. She didn't stop. She pulled up Morrison's chart, started documenting, and thought about how her career at this hospital was almost certainly over. She thought about it the way she'd learned to think about loss, clearly, directly, without flinching. And then she set it aside, because the 4 soldiers still in the bays needed updated assessments, and one of them had a pressure reading that was going to require attention in the next hour. Tessa appeared at her shoulder. Rollins is asking for you. She finished the line she was documenting. Tell him I'll be there in 5 minutes. He's not asking, Tessa paused. He's pretty insistent. She saved the chart and walked to Bay 6. Rollins had pulled himself to sitting, which was not something she would have recommended, and which was probably physically difficult enough to be impressive, even on a day when he hadn't had fluid drained from around his heart. Up close, with him conscious and focused, she could see the lines in his face that said he'd been doing hard things for a long time. He looked at her, and something in his expression shifted, something that moved like a slow change of weather. You ran a pericardiocentesis without imaging guidance for the first 90 seconds, he said. His voice was hoarse. Then you placed the decompression needle at exactly the right subxiphoid angle. And someone told me you did a cranial decompression in Bay 3. He paused. What's your name? Ellison. Mara Ellison. You need to lie down. Ellison. He said it like he was checking it against something. What did you do before this? She looked at him for a moment. Out in the corridor, she could hear Garrett's voice still going, still building whatever he was building. The lights above them flickered again. Somewhere down the hall, one of the other soldiers was asking for water. Right now, she said carefully, I'm an ER nurse at Garrison Point Medical Center, and that's the only thing that matters tonight. Rollins held her gaze for another 3 seconds. Something in his face had gone very still. Okay, he said softly, but he didn't look away. And he didn't look away. That was the thing Mara carried with her as she left Bay 6 and moved back into the controlled wreckage of the trauma corridor. Rollins's eyes had followed her all the way to the door, steady and assessing in a way that had nothing to do with gratitude and everything to do with something she couldn't yet name. She filed it in the back of her mind the way she filed everything she couldn't address in the moment, carefully, in a place she could find it later, and put her attention back on the 5 men who still needed her. The next 40 minutes moved the way bad nights always moved, which was to say they moved fast and ugly and without the clean narrative arc that people imagine trauma medicine had. The fourth soldier, a young ranger named Paredes, had a femoral wound that the field tourniquet had been managing but which needed a proper vascular repair that she could not perform. So she did what she could, repacked it, placed a second tourniquet proximal to the first, got him on a higher flow of O negative while they waited, and she was honest with herself about the fact that waiting was a gamble she hated. The fifth soldier, Okafor, had 2 fractured ribs and a splenic laceration that the ultrasound confirmed, and he was currently on the stable side of unstable, which meant she had maybe an hour before that math changed. She updated Whitfield on both. He listened, nodded, asked the right questions, and at no point told her to stop. Garrett, however, was not Whitfield. She became aware of him again when she was in the middle of reassessing Del Vecchio. Chest tubes still draining well, sat holding in the mid-90s, which was better than she'd honestly expected, and she heard raised voices near the nurse's station. Not a patient. She recognized the cadence before she could make out the words. Garrett, and someone pushing back, which was not a common sound in this building. It was nurse practitioner Sandra Briggs, who was 53 years old and had been at Garrison Point for 19 years, and who had, in Mara's assessment, been tolerating Philip Garrett's particular brand of institutional arrogance for about 15 years longer than any reasonable person should have to. Sandra was standing at the station with a printout in her hand, and she was not raising her voice, exactly, but she was also not lowering it, and that was its own kind of statement. The blood bank is down to 4 units of O-neg, Sandra said. I put in a request for emergency resupply 40 minutes ago, and it hasn't been approved. The approval process exists for a reason. The reason is budget management, Director. The current situation is 6 trauma patients, 2 of whom have had significant hemorrhage. I'm aware of the situation. Then approve the resupply. Garrett looked at her with the expression he used when he wanted to communicate that a conversation was over. I'll review it when I've had a chance to assess the full picture. With respect, Sandra said, in a tone that contained approximately 0 respect. By the time you've assessed the full picture, we may not have the blood to give. Mara finished her assessment of Del Vecchio, made a note, and walked to the station. She didn't look at Garrett. She pulled up the blood bank screen, checked the current inventory herself, and then she looked at Sandra. Get on the phone with Mercy Regional. They're 40 miles north, but they have a helicopter pad, and they've done emergency blood transfers before. Tell them what we have and what we need. That's not the... Garrett started. It's not a procedure that requires your approval, Mara said. Hospital-to-hospital resource sharing in a declared emergency operates under a different authorization pathway. It's in the Regional Disaster Protocol. Page 12. She had read that protocol. She had read it because 8 months ago she had submitted a recommendation that the ER staff be required to know it, and Garrett had declined to implement mandatory training, and so she had simply learned it herself. She met his eyes briefly, not combatively, just factually. And then she looked back at Sandra. Make the call. Sandra made the call. Garrett stood very still for a moment, the stillness of a man deciding whether to escalate, and then he turned and walked toward his office, which was down the administrative corridor and around a corner, and crucially, out of the trauma bay. Whitfield appeared at Mara's elbow. He'd been hovering at the edges of things all evening, she'd noticed, present, useful, clearly conflicted in a way that was costing him something. He's documenting everything, Whitfield said quietly. I know. Mara, James. She turned to look at him directly, because he deserved directness. I know what's coming. I knew it when I picked up the needle in Bay 6. Whatever he files, whatever review they open, that's a problem for tomorrow. Right now, Okafor has a splenic lac that's going to declare itself in the next hour, and Paredes needs vascular intervention that none of us can provide. And I need you with me, not managing him. She paused. Are you with me? He was quiet for 3 seconds, which was 3 seconds of him doing the calculation that every physician eventually had to do. The one that weighed professional caution against the thing directly in front of them. Yes, he said. Good. Then let's go look at Okafor. Okafor was 27, from the way he spoke and moved even in pain. Precise, economical, the kind of person who didn't waste motion. His abdominal rigidity had increased in the past 20 minutes, which was not a surprise but was also not good, and when Mara repeated the fast exam, his free fluid had increased measurably. His pressure was holding at 92 systolic, but his heart rate was climbing, 102, 106, the body compensating harder as the bleeding continued somewhere in his abdomen. The spleen most likely, but possibly also a mesenteric vessel she couldn't rule out without CT. "How bad?" he asked. He was looking at the ceiling. His hands were flat on the gurney beside him, which she recognized as a pain management technique, something to press against. "You're bleeding internally," she said. "Not fast enough to put you in immediate danger, but we need to stop it. That requires a surgeon." "Which you don't have." "Which we're working on getting." She adjusted his IV flow, checked his access. "I need you to stay still and stay calm. Your body is doing a lot of work right now to keep things stable, and stress makes that harder." "I've been shot twice," he said, in the tone of someone providing a relevant data point. "I know how to stay calm." "I know you do." She looked at him for a moment. The tension in his jaw, the careful way he was managing his breathing, the intelligence in his eyes that was working to stay ahead of the fear. "You're doing well." "Yeah, a beat." "You're not what I expected when they brought us in here." She didn't answer that. She made her notes and moved on. The call to Mercy Regional had worked. Sandra confirmed it 15 minutes later. A helicopter with 4 units of O-neg and 2 units of AB plasma en route. ETA, approximately 25 minutes, depending on the storm. It was not everything they needed, but it was something, and Mara let herself feel the small relief of it before moving on to the next problem, which was that the generator was becoming inconsistent. The lights had flickered 4 times in the past hour. That was normal for generator operation during a severe storm, mostly, but the ER's primary backup unit was one she had flagged in a maintenance report 7 months ago. The issue was a fuel line coupling that showed early signs of deterioration. The facilities team had noted it, estimated the replacement, and then the budget cycle had come around and the repair had been deprioritized. She knew this because she had followed up on it twice and received the same answer both times. It was on the list. It would be addressed in the next maintenance window. She found the overnight facilities supervisor, a man named Decker, in the utility corridor checking the panel. He was 50-something, competent, wearing the expression of a man whose bad feeling about the night had been fully validated. "How long does the generator hold?" she asked. Decker pulled out his phone, checked something. "Hard to say with that coupling. Could be fine all night. Could be we lose partial power in the next hour if the load keeps climbing." "What's the load doing?" "Climbing." She looked at the panel for a moment, thinking. "What do you need to stabilize it?" "Ideally, a new coupling and 4 hours. Realistically, I can reduce the load if some of the non-essential systems go offline. Admin wing, conference rooms, the cafeteria. Drop the demand and the stress on the coupling decreases." "Do it. That requires authorization from..." "In a declared emergency, the charge nurse or senior medical officer can authorize operational modifications to protect patient care." She said it without inflection, the way she said things she'd taken the time to learn. "I'm the senior medical person in the building right now. Consider it authorized. Get Doreen Park to co-sign if you need a second signature." She looked at him steadily. "Can you do this in the next 10 minutes? Decker studied her for about 4 seconds. "Yeah," he said. "I can do it." She was back in the trauma corridor when the helicopter from Mercy Regional arrived on the roof, and the blood products came down and Sandra and Tessa moved with quick efficiency to get them inventoried and distributed, and for about 15 minutes the situation felt like something that was being managed rather than something that was managing them. That feeling was one Mara had learned not to trust, not because she was pessimistic, but because emergencies tended to have opinions about the moments when you thought you had them under control. At 11:47, Morrison seized. She heard the alarm from 20 feet away and was running before the sound fully resolved. The cranial decompression had bought time. She'd known that, had been clear with herself that it was a temporizing measure and not a definitive treatment, but time had run out faster than she'd hoped. Morrison's body was rigid on the gurney, the monitor showing the chaotic electrical noise of a generalized seizure, and the team around him was doing what they should do, protecting his airway, positioning, timing. But she could see his color, and she could see the monitor, and she knew that the pressure inside his skull had continued building despite the decompression, and the seizure was the brain's response to that pressure, finding nowhere to go. "Lorazepam," she said, already at the bedside, already doing the calculation on weight and dose. 2 milligrams IV push, and I need a second IV site. His primary is looking positional. The seizure broke at 90 seconds. Morrison went limp post-ictal, breathing but unconscious in a way that was different from the unconsciousness he'd arrived in. Deeper, more tenuous. The monitor showed an improvement in the rhythm, but his blood pressure had spiked during the seizure and hadn't fully come back down. Whitfield was beside her. "He needs neurosurgery." "I know." "Mara, I can't. I'm not asking you to." She straightened up, turned to face him. The strip lights above them chose that moment to flicker, a long, deliberate flicker that lasted almost 2 full seconds before stabilizing. In that intermittent light, Whitfield looked tired in the way that was different from being physically tired, the kind of tired that came from watching something you believed in get complicated. "What I'm asking," she said, "is for you to manage his pressure pharmacologically while I figure out if there's a neurosurgeon anywhere within helicopter range who can get to us in the next 2 hours. The storm is easing to the north. I checked 30 minutes ago." She had checked, on her phone, on the weather service app, because she checked things. "There's a window. I need someone on the phone finding a neurosurgeon who can fly into the gap." Whitfield looked at her for a moment, then he turned to the nursing station and picked up the phone. She spent the next 20 minutes on coordinated calls, working through Sandra and a hospital administrator named Flores, who had come in during the emergency and who, unlike Garrett, seemed to understand that her job in this situation was to facilitate rather than authorize. They found a neurosurgeon, Dr. Patricia Sable, from a trauma center 60 miles northeast, who had been monitoring the weather and had already been in contact with the regional coordinator about potential transfer cases. Sable said she could be in the air in 40 minutes if the window held. Mara said hold for confirmation and went back to Morrison, assessed him again, talked to Whitfield about the pharmacological management, made the call that the window would hold, and called Flores back with the green light. It was while she was on that call that she became aware of Rollins again. He had not, apparently, stayed in Bay 6. She found him in the doorway of the main trauma corridor. On his feet, which he should not have been, wearing his hospital gown with a level of dignity that was genuinely impressive given the circumstances. He was standing with one hand on the doorframe, not for dramatic effect, but because he actually needed the support. And he was watching the corridor with eyes that were taking in everything with a methodical focus that she recognized. That was a kind of watching that was trained, professional. "You need to be in bed," she said. "I've been in bed for 40 minutes. You had a cardiac tamponade 40 minutes ago." "I'm aware." He straightened slightly, a reflex he probably wasn't conscious of. "Morrison. How bad?" She considered what to tell him. These were his soldiers. He'd been responsible for them before tonight, and the fact that he was lying on a gurney in an ER didn't change that in his mind. She could see it clearly. "Unstable. We have a neurosurgeon coming in from the northeast. If the weather window holds, she'll be here in under 2 hours. Rollins absorbed this. "And the others?" "Del Vecchio is improving. Okafor is holding but needs surgery we can't do here. Paredes is stable for now." She met his eyes. "I'm not going to lose your people if I can help it, but I need you in that bed so you stop being one of my problems." Something shifted in his expression. Not offense, more like the look of a man encountering a very specific kind of directness that he didn't often find. "You have a background in military medicine," he said. "Not a question." "I have a background in emergency medicine," she said. "Go back to your bay." "Ellison." He said her name carefully, the way he'd said it before. "The pericardiocentesis you ran. The landmarks you used, the subxiphoid approach at a specific angle, without initial imaging, as a primary rather than backup technique. That's not taught in standard emergency medicine training." She looked at him. The corridor was busy around them. Nurses passing, a tech with a cart. The ambient noise of a hospital working harder than it was built to work. She kept her face neutral because she'd been keeping her face neutral about this particular subject for 4 years, and she was practiced at it. "Go back to your bay," she said again, and this time he went. But his eyes stayed on her for the 3 seconds it took to turn, and she knew, the way she knew things, that this conversation was not finished. Garrett returned from wherever he'd been at 12:15, and he did not come alone. With him was a woman Mara didn't recognize. Tailored jacket, clipboard, the efficient posture of someone from hospital legal or risk management. They went directly to the nurses' station, and Garrett spoke to Doreen Park in low, clipped sentences, and Doreen's face did the thing it did when she was receiving information she didn't like and wasn't going to say so out loud. Mara was watching from Bay 2, where she was doing a follow-up on Del Vecchio, when Doreen crossed to her. "He's calling for a formal review," Doreen said. "The woman with him is from the hospital's legal team. They want a complete accounting of every intervention you performed tonight, every medication, every procedure, and they want it before the end of shift." "That's fine." "Mara." Doreen dropped her voice further. "He's using the word unauthorized. He's talking about emergency suspension pending review." She paused. "Effective immediately." Mara set down the chart. She looked at Del Vecchio, who was awake and watching them with the alert attention of a man who was trained to pay attention to what people said when they thought he wasn't listening. She looked at the blood pressure on his monitor, 108/70, which was the best it had been all night. She looked at the chest tube, draining steadily. She looked at Doreen. "Okay," she said. "Okay?" Doreen stared at her. "He's going to pull your credentials." "I heard you." She kept her voice even. "If he suspends me, I stop having the authority to make medical decisions in this building. I know that. I also know that Okafor's pressure is trending down, and Paredes is due for another tourniquet check in 20 minutes, and Morrison is being managed by a physician who has everything I've told him to do, so if Garrett wants to suspend me, the paperwork can wait until I've handed off properly." She looked at Doreen one more time. "Tell him I'll be available for his review at the end of my shift. Tell him I'm happy to account for every single thing I did tonight, in writing, in detail." Doreen looked at her for a long moment. "You're not scared?" It wasn't a question, so Mara didn't answer it. She picked up the chart and finished her note on Del Vecchio. What she was, and what she didn't say, was tired. Not physically. Or not only physically. There was a kind of tired that came from doing the right thing inside a system that kept asking her to justify it, that kept making her prove, in small ways and large ways, that she was capable of the things she was capable of. She had been tired like this before, in other buildings, other institutions, other situations where she'd known something the people above her didn't know and had chosen not to announce it. That choice had always felt like the right one. She wasn't certain it felt like the right one tonight. At 12:41, Rollins's monitor alarmed. She heard it from the corridor and processed the sound before she was fully conscious of processing it. The specific pattern, the rate, the tone, and she was moving before the nurse in Bay 6 had finished turning toward the screen. Rollins was in VTAC, not the sustained kind, not yet, but his heart had been through significant stress tonight, and the pericardial sac had been under pressure for longer than they'd known before he arrived, and the rhythm was unstable in a way that could become very bad, very fast. She was at the bedside before anyone else. Rollins was conscious, which was both better and worse. Conscious meant he knew what was happening, which meant he was frightened even if he was working extremely hard not to show it. "I need the crash cart," she said, "and someone get me lidocaine." She put her hand on his wrist, not for the pulse. She had the monitor for that. But because it was one of the things she'd learned early, that touch mattered, that the body responded to contact in ways that monitoring equipment couldn't replicate. "Rollins, look at me." He looked at her. "Your heart is doing something we need to correct. I'm going to give you a medication, and I need you to breathe slowly and let it work." "Is it going to work?" he asked. "Yes," she said, and she said it the way she said things she intended to make true. The lidocaine went in. The monitor showed the rhythm wavering, worse for 10 seconds, then 8 more that lasted longer than they had any right to. And then it broke, and sinus rhythm returned, imperfect and slightly fast but fundamentally organized, and she let out the breath she'd been holding in the back of her lungs. Rollins's eyes hadn't left her face. "You've done this before," he said. "A lot." "Rest," she said. "Not in an ER." She checked the monitor one more time, made sure the rhythm was holding. The crash cart was beside her, still unused, its presence in the room the reminder of how close things had just gotten. She started to move, and Rollins spoke again, his voice lower now, quieter, carrying something that wasn't quite a question. "There was a protocol," he said. "A battlefield trauma protocol, revised in 2019, used by 3 different special operations units across multiple theaters." He paused. "It was authored by a trauma surgeon who left active service in 2021. The name on the document was redacted in the version we were given, but the methodology was distinctive, specific." His eyes were steady on her. "I've seen that methodology twice tonight." The crash cart was still beside her. The monitor was still beeping. Down the hall, someone was calling for assistance with a transfer. Everything kept moving, the way it always kept moving, because the world did not pause to accommodate the moments when it got rearranged. Mara looked at him for one long, still second. Then Doreen was in the doorway. Her face had changed, gone past worried into something that was close to frightened. "Mara," she said. "It's Paredes." His pressure just crashed. She was already moving. Nobody moved. That was the thing about a certain kind of authority. It didn't announce itself, didn't perform, didn't need to fill the room with noise. The man in the doorway had said 8 words, and the corridor had reorganized itself around them, the way water reorganized around a stone dropped into it. Not dramatic, just physics. He was Colonel Aaron Vast, and Mara didn't know that yet, but she would. He was 52 years old, medium height, the kind of build that came from decades of functional use rather than deliberate cultivation, and he wore his uniform the way men wore it when it had been their professional skin for long enough that putting it on was no different from breathing. He had 2 people with him, a woman in civilian clothes with a federal ID visible on a lanyard, and a younger man in uniform carrying a hard case that Mara recognized as the kind used for secure data storage. They had come in through the administrative entrance, which meant someone had let them in, which meant this had been coordinated before they arrived, which meant the timeline of tonight was longer and more structured than it had appeared from inside it. Garrett turned to face him with the specific expression of a man who was recalculating rapidly. "This is a private medical facility," he said. "I'm going to need to see identification, and you'll have it." Vaste was already moving into the corridor, his eyes going to the bays, to the staff, to Mara last. When he looked at her, it was the same look Rollins had been giving her all evening, the look of a person locating something they'd been tracking. "Director Garrett, I'm Colonel Aaron Vaste, Army Medical Command, JAG Liaison. The 6 personnel admitted to your facility tonight are active duty special operations soldiers on a classified training operation. Under federal statute, their care, their welfare, and any documentation related to tonight falls under military jurisdiction." He paused. "You should probably put that badge down." Garrett looked at the badge in his hand. Mara's badge. The one he'd taken 12 minutes ago with the satisfaction of a man who believed he'd just won something. He set it on the nurse's station counter with a deliberateness that was meant to look voluntary. "I'm in the middle of a personnel action," he said. "This employee performed unauthorized." "I heard what she performed," Vaste said. "I've been in the building for 22 minutes. He didn't elaborate on where he'd been for those 22 minutes, but the woman in civilian clothes was already moving toward the workstation with the kind of quiet efficiency that said she'd been building a picture of this facility for longer than 22 minutes. "We'll discuss the personnel action. Not right now." Mara had been standing in Bay 2 with her hands still at Del Vecchio's chest, monitoring the re-established drain, watching the saturation climb, 91, 94, and she stayed there because the patient in front of her was the priority, and everything else was secondary information, interesting but not actionable in the next 4 minutes. Whitfield appeared beside her and didn't say anything, just looked at the monitor, confirmed what she was seeing, and made his own note. "Stable?" he said quietly. "For now." She checked the seal one more time. "I need someone watching him every 10 minutes. That tube shifts again without intervention and we're back to 0. I've got him. She stepped back from the gurney, and Del Vecchio, who'd been awake for all of it, looked at her with eyes that were too tired for the expression in them to cost him much. You came back, he said. The tube came out, she said. Same thing. He closed his eyes. Same thing. She walked out of Bay 2 and into a corridor that had changed in the way corridors changed when the power dynamic in a space shifted and everyone could feel it before anyone had said the definitive thing. The staff were at their stations doing their work, but watching. The peripheral attention of people who understood that what was happening in the hallway would affect them and were calibrating accordingly. The legal team representative who'd been with Garrett had stopped writing on her clipboard. Garrett himself was standing at the far end of the station with the containment of a man who was managing a very specific kind of fear. The fear of someone who had believed all night that he held the authority in the room and was now doing the math on what it meant that someone else had just walked in and the room had listened to them instead. Vaste crossed to Mara. Up close, he had the weathered quality of someone who'd spent a lot of time in environments that aged people unevenly. Something in the skin around his eyes, in the set of his jaw. He extended his hand. Colonel Vaste. She shook it. Mara Ellison. I know who you are, Major. I'm not a major anymore. No. He looked at her steadily. You're not. Something in that acknowledgement was careful, not evasive, just precise. The way a man was precise when he'd thought about what he was going to say and chosen it specifically. How are my soldiers? She gave him the rundown the way she'd been giving rundowns all evening. Clean, fast, no editorializing. Morrison with Sable upstairs, prognosis cautiously improving. Paredes on REBOA, surgical team on standby. Critical window of 2 to 4 hours. Okafor in active evaluation with Torres, surgical intervention likely within the hour. Del Vecchio stable, chest tube reestablished, monitoring required. Rollins post-tamponade, post-arrhythmia, stable, but not to be left unmonitored. The sick soldier, Kwame, the one who'd presented most intact and who she'd been least worried about, had developed a stress reaction in the past hour that she'd managed pharmacologically and who was currently the most settled of the group. She delivered all of it in under 3 minutes. Vast listened without interrupting. What do you need? A vascular surgeon for Paredes in the next 2 hours. Torres can manage Okafor. Morrison's covered. What I need is someone who can take over Paredes' care when the REBOA has to come out, because that transition is going to be the moment, and I want the right person managing it. I have a vascular surgeon from Harwick on standby, the woman in civilian clothes said from the workstation. She had a voice like someone who'd run a lot of conference calls. She can be here in 90 minutes. That's cutting it close. It's what we have. Mara looked at the ceiling for 1 second, an old habit, a way of buying half a breath without anyone reading it, as uncertainty, and then looked back. 90 minutes. Okay. Whitfield manages Paredes until she arrives, with me available by phone if the window closes faster. Vast nodded. You'll be in the building. Garrett from across the station. She's been suspended. She doesn't have credentials to... Director Garrett. Vast turned, and it was not a fast movement or a threatening one, but Garrett stopped talking. We're going to sit down in about 30 minutes and have a comprehensive conversation about this facility, tonight's events, and several other matters. Until then, I'd appreciate it if you'd let us work. Garrett's legal representative put her hand on his arm and said something in a low voice, and whatever she said made him go quiet in a way that was different from the quiet of confidence. It was the quiet of someone who'd just been told to stop talking by someone who knew more about the situation than he did. The civilian woman from Vaste's team, she introduced herself only as Agent Ferrara, Federal Health Oversight, and left it at that. Spent the next 40 minutes moving through the hospital with the quiet comprehensiveness of an audit that had been prepared in advance. She went to the blood bank and documented the current inventory. She went to the generator room with Decker and documented the coupling failure and the maintenance history. She pulled the procurement records for the REBOA kit, the emergency protocols on file with the state, the safety reports submitted to administration over the past 3 years. Mara knew she was doing these things because Doreen Park was tracking her movements and relaying them in the compressed shorthand that nurses used when they wanted to communicate without being obvious about it. The safety reports. Mara had submitted 14 of them in 3 years. She knew the number precisely because she'd kept copies of all of them, each one time-stamped, each one documented with the response she'd received or the lack of one, each one filed in a folder on her personal laptop that she kept at home, because she'd known, in the persistent pragmatic way she knew things, that documentation was the only language institutions reliably understood. At 2:47 in the morning, Torres came out of Okafor's bay and found Mara at the station. "He needs the OR," Torres said. "Splenic lac is grade 3, trending toward 4. I can manage it laparoscopically if we move now." "OR1 is still occupied?" "OR2 is free. Ashfield finished 40 minutes ago." She looked at Whitfield, who nodded. "I'll cover the bays," he said. "Go." She wasn't going as surgeon. She was going as the person who knew Okafor's case from the first 5 minutes, who had the imaging and the timeline and the context that Torres didn't have, and who Torres had already demonstrated he was willing to work with. It was not the same as what she'd been doing all night. It was quieter. But it mattered, and she went. Okafor, being prepped, looked up at her when she came in. His focus was sharper than she'd expected. The anesthesia hadn't gone in yet. "You're staying," he said. "I'm not scrubbing in," she said. "But yes." He held her gaze for a moment, this precise, economical soldier who didn't waste words. "Good," he said, and that was all. The laparoscopy took an hour and 12 minutes. Torres worked clean and careful, the nervousness she'd seen in him before having been replaced by the focused competence of a surgeon in his element, and the spleen was manageable, the repair solid. And when Okafor's pressure stabilized on the table at 4:11 and Torres looked up over his mask with the expression of someone who'd done a good thing, Mara was standing at the scrub sink and she let herself feel it for exactly the length of time it took to peel her gloves. Then she went back downstairs. The corridor at 4:30 had the specific quality of a long night that had turned a corner without quite arriving at morning. The red emergency lighting had been supplemented by portable units Decker had pulled from storage, and someone had made coffee, real coffee, from the break room machine, and the smell of it was incongruous and necessary in the way that small normal things were necessary when everything else had been operating at the edges of what normal was. Vast was in the family consultation room with Garrett and Ferrara and Garrett's legal representative, and the door was closed, and had been closed for the past 45 minutes. Nobody in the corridor was pretending not to notice. Rollins called for her one more time. She went, because at this point she'd stopped pretending she was going to successfully avoid him. He was lying down, which was an improvement, though she suspected it was strategic again. The posture of a man who'd decided that being horizontal was the most effective way to keep her in the room long enough to say what he wanted to say. His cardiac rhythm on the monitor was clean and regular. His color was the best it had been all night. "Vass talked to you?" she said. "Before he went in with Garrett?" "Yes." He was looking at the ceiling, which was its own kind of tell. Rollins, looking at a ceiling instead of at her, meant he was choosing his words. "He told you they had audio?" "Yes." "All of it." He paused. "Garrett refusing resources. Garrett photographing you while you were operating. Garrett attempting to delete the security footage from the administrative servers before Ferrara locked the system." He turned his head to look at her then. "You didn't know about the footage deletion." She hadn't. She kept her face even. "No." He tried to pull the camera records from the trauma corridor and the blood bank at 11:53. Ferrara caught it because she'd already flagged the system the minute they arrived. He held her gaze. He was building something, not just tonight. The safety reports you filed, Ferrara pulled them, all 14, cross-referenced with the actual maintenance records. He stopped. The generator coupling report, the blood supply reduction, 3 years of documented warnings that went nowhere. Ferrara is calling it systematic suppression. Mara sat down in the chair. Not heavily. She didn't have the energy for dramatic collapses, just sat, the way a person sat when they'd been standing for 11 hours, and a chair was available. That's her assessment to make. It's the right one. Maybe. She looked at her hands, the same hands she'd been looking at on difficult nights for 30 years, in different places, under different lights. They looked like what they were. What happens to this hospital if Garrett goes down hard isn't a simple thing. There are 300 staff here, a community that depends on this facility, a suspension of operations, an investigation, a leadership vacuum. Those have consequences that aren't just about him getting what he deserves. Rollins was quiet for a moment. You're already thinking about the after. I'm always thinking about the after. That's not a nurse's job. No, she agreed. It isn't. The consultation room door opened at 5:09. Garrett came out first, and the way he walked was different. Not obviously, not in a way a stranger would have caught, but Mara had been watching Philip Garrett walk through this building for 3 years, and she knew his walk the way you knew a sound you'd heard enough times to identify it without looking. What was missing was the forward lean, the proprietary set of his shoulders, the quality of movement that said he was going somewhere that was his. He came out of that room and moved through his own corridor like a man walking through a space that had already started to become someone else's. Behind him came his legal representative, who was on her phone, her jaw tight. Behind her, Ferrara, with her clipboard and her federal lanyard and the unhurried expression of a woman whose job was going exactly as expected. Behind her, Vaste. Vaste looked at Mara. He crossed to her. He's been notified of a formal federal review of this facility's emergency preparedness compliance, patient safety records, and administrative conduct, he said. His operational authority is suspended pending the review. The board is being convened. He paused. That's the institutional piece. The rest is going to take longer. The rest, she said. The blood supply reductions were budget decisions he documented. The maintenance deferrals were approved at his level. The safety reports... He stopped, chose what he was going to say next. He was aware of the generator issue. The maintenance team's records show an escalation to his desk 8 months ago. His response was to downgrade the priority rating. He looked at her steadily. That's a patient safety violation at a level that goes past administrative review. She absorbed this. Not with satisfaction. She'd known what kind of person Garrett was for 3 years, had not needed tonight to confirm it, and the confirmation now felt less like vindication and more like the particular grief of being right about something you'd wanted to be wrong about. The staff here, she said, they didn't do this. I know that. The people who are going to work here tomorrow and next month and in 5 years, they need a functional facility, not a facility that's been gutted by an investigation. That's not how this works, Vast said, and his tone was not dismissive. It was the tone of a man who'd been through institutional corrections before and knew the shape of them. The investigation protects the facility. The alternative is the facility continuing to operate the way it's been operating. He paused. What happened tonight with those generator logs? What happens when the next storm comes and the coupling actually fails? What happens to the next patients who need blood products that aren't there because someone cut the supply order to protect a budget line? She didn't answer because it wasn't a question. At 6:15, Dr. Patricia Sable came down from the OR to find Mara at the nurses' station. The neurosurgeon looked like someone who'd been working for 4 hours straight, which was because she had been, and she had the specific kind of controlled exhaustion that surgeons carried when a case had gone long but gone well. Morrison, Sable said. Yes. He's out. Post-op monitoring ICU. The decompression you did bought us the window we needed. If you'd waited another 20 minutes to intervene, the damage would have been irreversible. She said this plainly, not as a compliment. She didn't seem like someone who delivered compliments often, but as a clinical assessment. Where did you train? Does it matter right now? Sable looked at her for a moment. No, she said. I suppose it doesn't. She picked up a cup of coffee from the station, looked at it, set it down. You did good work tonight. The whole thing. The sequencing, the prioritization, the REBOA on Paredes. She paused. The cranial decompression especially, the angle of approach you used. I've seen that in exactly 2 other places. One was a trauma journal article published in 2019. The other was a military field surgical manual. She looked at Mara with the professional appraisal of one specialist assessing another. The journal article was co-authored by a military surgeon. Another pause. I don't think the 2 sources are unrelated. Get some rest, Mara said, and thank you for coming. Sable picked up the coffee again, this time actually drinking it. I'll be back for Morrison's morning rounds. She left. At 6:48, Garrett attempted to access the administrative server from his office. Ferrara had anticipated this, or something like it, the attempt of a man who believed that data he controlled was still his to manage, and the access was logged and blocked simultaneously, the notification going directly to her tablet. She was in Garrett's office 4 minutes later with a federal preservation order, and Mara learned about this from Doreen, who'd been told by the IT coordinator, who had been watching the access logs at Ferrara's request since approximately 2 in the morning. What the server access attempt revealed, what Ferrara found when she pulled the administrative logs in full, was that Garrett had been making changes to documentation for the past 3 months. Not the safety reports, which existed in the nursing system he didn't control. The hospital's emergency preparedness certifications. The state reporting records that confirmed compliance with blood supply minimums. Generator maintenance schedules. Trauma readiness protocols. Documents that told the state oversight board that Garrison Point Medical Center was operating at a level it hadn't been operating at for at least 2 years. Falsified compliance records. That was a different order of problem from administrative negligence. That carried different consequences, the kind that were no longer internal to the hospital. Mara was told this by Vaste at 7:20, standing in the corridor outside the bays, while the morning shift was coming on and the night was beginning its slow release of the building back to something resembling normal operation. She was 36 hours past her last real sleep, and her feet had passed the point of complaining about it, and she listened to Vaste lay out what they'd found with the same attentiveness she'd been applying to everything all night. "The DA's office will be contacted this morning," he said. "The State Health Board has already been notified. The Board of Directors is convening an emergency session at 9 a.m. He paused. Garrett is not going home today. She thought about that. She thought about the way he'd held her badge. Her badge, the thing that represented 3 years of work in this building, the thing that said she was allowed to be here and do what she did. She thought about the smile he'd worn when he'd taken it. "The staff," she said again. "I know." He looked at her with a steadiness she'd come to recognize as his characteristic expression, the look of a man who didn't reassure people unless he meant it. "The board will appoint interim leadership before the end of today. The oversight review is focused on Garrett's conduct, not the institution's operations. The hospital stays open." She nodded. "Let it settle." "Okay. Okay," he repeated, and there was something in the way he said it, a small pause, a weight to the single syllable, that told her it wasn't only about the hospital. "Major Ellison, I'm not. I know you're not. I know." He looked at her carefully. 4 years ago, you made a choice to leave. Nobody from the Army is here to contest that choice. What happened at Kestrel? You wrote a report. You were honest in it. The conclusions you drew were correct, and the people in command at the time made different decisions, and you chose to live with that by walking away. He paused. "That's your right. It still is." Another pause. "But tonight happened, and the record of tonight is going to exist, and some things, once they're visible, don't go back to invisible just because you'd prefer them to." She looked at him for a long moment. Around them, the hospital breathed and moved, the morning shift nurses getting handoffs, the day beginning its accumulation of ordinary needs and small emergencies, the world outside the windows going from gray to the tentative light of a coast morning after a storm. The bay windows showed Del Vecchio asleep. Rollins, she knew without looking, was awake. "I understand," she said. "There's one more thing," Vasta said, and his voice changed, not dramatically but enough. The same voice, different register. The voice of a man delivering information he'd been carrying for a while and wasn't certain how it would land. "The audio records from tonight, all 6 soldiers' equipment. We've pulled the compilation. Ferrara has reviewed the complete record." He paused. "Garrett is on the recording, clearly and repeatedly, directing staff away from emergency interventions while soldiers were dying, refusing resources. The footage deletion attempt is documented. The communications threatening your license are documented." He met her eyes. He made a comment, at 11:44, to his legal representative, about your personnel file, about making sure the review resulted in permanent revocation. Another pause. He used the phrase, and this is a direct quote, "She'll never work in a hospital again." Mara didn't say anything. The legal representative, Vaste continued, made a note on her clipboard in response. Ferrara has that clipboard. He looked at her steadily. I wanted you to know the full picture before the 9 o'clock meeting, before you hear it from someone else, in a room with other people. She was quiet for a moment, a long moment by her standards. Who's running the 9 o'clock meeting? She asked. The board chair, a woman named Harriet Odom. She's been chair for 8 years. She's already reviewed the preliminary summary Ferrara prepared. He paused. She asked specifically whether you'd be available to attend. I don't have credentials. You have a board-level invitation. He reached into his jacket and placed her badge on the counter between them. Doreen Park countersigned a temporary emergency authorization at 2:17 this morning after Garrett's suspension. It's been in the system since then. He looked at her. You've had credentials for the past 4.5 hours. She looked at the badge on the counter. The small laminated rectangle with her name and her photo and the words Garrison Point Medical Center. Emergency nursing in the institutional font she'd read 1,000 times. She picked it up. She didn't put it on. She held it. At 8:52, 7 minutes before the board meeting was scheduled to begin, she was walking toward the conference wing when her pager, the hospital pager clipped to her scrub pocket, the one nobody had collected because nobody had thought to, or perhaps because the morning shift coordinator had quietly re-enrolled her number at shift change, went off. Bay 2, Del Vecchio. She changed direction without breaking stride because some things didn't wait for board meetings. Del Vecchio was awake and sitting up, and the monitor was fine, and the chest tube was fine, and his saturation was 97, the best it had been all night. And when she came in, he looked at her with the direct, uncomplicated focus of someone who had something to say and had been waiting for the right moment to say it. I need you to know something, he said, before whatever happens next. I need you to know that when they brought us in here last night, I thought I was done. I genuinely thought that was it. His voice was steady, the voice of someone reporting a fact. And then you were there. And you didn't act like you weren't sure. You just worked. He paused. I don't know your whole story. Rollins does, I think, more than me. But I know what it looked like from that gurney, and I wanted to say that before you went into whatever meeting you're going to. She looked at him for a moment. How do you know I'm going to a meeting? Rollins told me. A slight lift at the corner of his mouth. He's been running intelligence on this building all night, from his gurney, with an IV in his arm. Of course he has, she said. Yeah, the almost smile again. He's pretty good at it. She stood in the doorway for one more second. You need anything before I go? No. He met her eyes. Go. She went. The conference wing was at the end of the administrative corridor, the part of the building that existed in a different register from the bays and the trauma rooms, the carpeted, climate-controlled register of institutional decision-making. She had been in this wing twice in 3 years, both times to file formal safety complaints. The carpet was the same. The lights worked correctly, on main power, the generator having been stabilized by Decker's load reduction and the coupling holding through the rest of the night. She pushed open the door to the conference room at 8:59. Harriet Odom was already at the head of the table, a woman in her mid-60s with reading glasses on a chain and the expression of someone who had reviewed Ferrara's summary and had arrived with a fully formed opinion. Around the table were 6 other board members, Ferrara, Vaste, and 2 individuals Mara didn't recognize who had the specific presentation of people from the State Health Board's office. Garrett was not there. Garrett was in his office with 2 individuals from the county DA's office who had arrived at 8:40 and who were at this moment going through his desk. Odom looked at Mara when she came in. She looked at her for a moment, the scrubs, the badge, the 11 hours of a hard night worn in the way faces wore hard nights, and then she gestured to the chair to her right. Sit down, please, Ms. Ellison, she said. We have a lot to discuss. Mara sat. Ferrara opened her laptop, pulled up the audio file, and looked around the table. I'll start from 11:42, she said. That's when Director Garrett re-entered the trauma corridor after the first documented refusal of emergency resources. The file began to play. Garrett's voice came out of the laptop speakers, clear and unambiguous in the quiet conference room, and the board members around the table listened, and the people from the state health board listened, and Mara listened to her own night played back in a man's voice doing the things she'd known he was doing and hadn't had the time or the leverage to stop. Odom's expression did not change while the recording played. She had the face of a woman who'd prepared herself for what she was hearing and was nonetheless finding it worse than preparation had allowed for. When Ferrara paused the recording at a particularly explicit moment, Garrett's voice saying, "Let her make her choices. And when this is over, we document every one of them and she's finished." Odom looked down at the table for a moment. Then she looked up. "How many safety reports?" she asked Mara directly. 14, Mara said. "Over 3 years. I have copies of all of them." Odom looked at the board member to her left, a man in his 60s who'd been on the board for 12 years and who had, presumably, been in at least some of the administrative decisions that had allowed this to persist. He did not look comfortable. "Did any of these reports reach board level?" she asked him. He said something Mara couldn't quite hear. "I need you to speak clearly, Richard," Odom said, with a flatness that was worse than anger. "Some of them," he said. "The framing we received was that the nursing staff had concerns that were being addressed through normal maintenance channels. The generator coupling was not addressed," Odom said. "The blood supply was reduced below minimum safety thresholds. 3 patients tonight came within minutes of dying in part because of those failures." She looked around the table. "We will address what the board knew and when, and what the board's obligations are in that context, separately and fully. That is a conversation for later today." She looked back at Ferrara. "Continue the recording." Ferrara continued the recording, and in Garrett's office at the end of the hall, behind a closed door, a man who had spent 7 years treating this institution as his personal domain sat across from 2 representatives of the county DA's office and began the process of understanding that the version of events he'd been building all night was not the version that existed in the documentation, in the audio, in the federal preservation order sitting on his desk, or in the expressions of the people looking at him. The recording reached the moment, 11:53, where Garrett had attempted to delete the security footage. The board member named Richard put his hand over his mouth. Odom closed her eyes for 3 seconds and opened them again. "Miss Ellison," she said, "I need to ask you something, and I need you to answer it honestly, even if the answer is complicated." "All right," Mara said. "If we asked you to stay—" Odom stopped, started again. "If this board asked you to remain at this facility, in a formal capacity, with full recognition of your complete background and qualifications, would that be a conversation you'd be willing to have?" Mara looked at her. She thought about the 14 reports. She thought about the 3 years. She thought about Delvecchio's saturation climbing, and Paredes's pressure holding, and Morrison upstairs in the ICU with Sable's repair holding together, and Rollins watching from Bay 6 with his dog tags in his hand. She thought about Rollins's voice. Some things, once they're visible, don't go back to invisible just because you'd prefer them to. She thought about the badge in her hand. "Yes," she said. "It's a conversation I'm willing to have." Odom nodded, once, the nod of a woman who'd been hoping for that answer and had not been certain she'd get it. Then Ferrara's phone buzzed on the table. She looked at it, and her expression changed. The specific change of someone receiving information that altered the shape of a situation they thought they understood. "Colonel Vaste," she said, and her voice was careful. "I'm getting a notification from the data server." She turned the phone so he could see it. "The audio compilation from the soldiers' equipment. Someone sent a copy." She paused. 40 minutes ago, before the preservation order was filed." Vaste looked at the notification. Then he looked at Mara, and for the first time all night, his composure had something underneath it. Not alarm, not exactly, but the quality of a man who'd just encountered a variable he hadn't planned for. "Who received it?" he asked. Ferrara looked at the screen. 3 recipients, she said. "The State Health Board, the Regional Office of the Federal Inspector General." She paused. "And the Callaway Bay Courier." The room held the notification the way a room held a sound that didn't belong to it. A beat too long, everyone recalibrating, Ferrara's phone face up on the table with its quiet, definitive information sitting there in plain text. Vaste was the first to speak. Who had access to the server? The unit's personnel, standard deployment protocol, 6 soldiers, the mission coordinator, and the battalion medical officer. Ferrara was already typing. The send timestamp is 4:41 a.m. That's while I was in with Garrett, Vaste said. Yes. Mara looked at the table. She thought about Rollins, lying in Bay 6 with his dog tags and his careful eyes, and the specific patience of a man who'd decided something and was waiting for the right moment to act on it. She thought about the way he'd said some things. Once they're visible, don't go back to invisible. And she understood now that he hadn't been offering her a philosophical observation. He'd been telling her what he'd already done. It was Rollins, she said. Vass looked at her. He had his phone, she said. He's been running his own assessment of this building all night. He knew about the audio. He made a decision. She paused. He made it before the preservation order, which means it wasn't a violation of anything. The order didn't exist yet when he sent it. Ferrara confirmed this with 2 keystrokes. Correct. The federal preservation order was filed at 5:22. The transmission was at 4:41. She looked at Vast. Clean. Odom, who had been listening to this exchange with the focused attention of someone gathering information before forming a position, set her glasses on the table. So the recordings are now with the State Health Board, the Federal Inspector General, and a regional newspaper. Yes, Farrar said, and there's no legal mechanism to retrieve them. No. Odom was quiet for a moment. Then she said, Good, and picked her glasses back up, and that was that. The Callaway Bay Courier ran the story at 11:15 that morning, which was fast for a regional paper and spoke to someone having made a decision about prioritization that overrode the usual editorial caution. The headline was restrained. Garrison Point Director suspended amid federal investigation into patient safety failures. But the content was not, because the content included direct excerpts from the audio record that Rollins had transmitted. And audio excerpts, even rendered as text, carried something that institutional summaries didn't. They carried the voice. They carried the specific, unambiguous sound of a man choosing, in real time, to obstruct emergency care while soldiers were dying in the rooms around him. Mara didn't read it when it ran. She was asleep. She had gone home at 9:45 after the board meeting had recessed to allow the members to review the full documentation Ferrara had compiled, after Vaste had confirmed that all 6 soldiers were medically stable and under appropriate supervision, after Doreen had physically put a hand on her shoulder and said go, and after she'd stopped at Bay 6 one last time. Rollins had been awake. He was always awake. You sent it, she said. Yes. You could have told me. You would have told me to wait for the proper channels. He held her gaze without apology. I've watched proper channels take 3 hours to approve blood resupply while men bled. I've watched proper channels get navigated and managed and delayed until the outcome they were supposed to prevent had already happened. His voice was even, factual, the voice of someone reporting experience rather than venting it. The recordings belong to the unit. I'm the senior officer present. That's my call. She looked at him for a moment. You're going to be a headache for someone's chain of command for a long time. Probably. Something shifted in his expression. Not quite a smile, but the thing adjacent to it, the thing that appeared in people when they'd been holding something for a long time and finally set it down. Get some sleep, Major. I'm not... I know, he said. Get some sleep anyway. She had slept for 6 hours, which was not enough and was also everything she had. She woke to 14 missed calls, a voicemail from Harriet Odom's assistant, 2 messages from Doreen, one from a number she didn't recognize that turned out to be a journalist from a larger coastal paper who had picked up the Courier's story, and one from a number she recognized immediately and had not seen on her phone in 4 years. She listened to the last one twice. Then she set her phone down and sat on the edge of her bed for a while, looking at the window, at the afternoon light on the bay that was clean and flat after the storm. The water settled into the particular stillness that followed violence. The number had belonged to Brigadier General Constance Adler, who had been Mara's commanding officer for the last 18 months of her active service and who had been in the room 4 years ago when Mara had submitted her resignation. Adler had not tried to stop her. She had said, in the direct and unsentimental way she said most things, that she understood Mara's reasons and that the door would remain open, and Mara had understood this as a courtesy rather than a literal statement of policy. The voicemail said, "I saw the Courier piece this morning. I've been briefed by Vast. Call me when you're ready. There's no pressure and no agenda. I just wanted you to hear my voice before you heard anything else." Mara sat with that for a while. Then she called Odom's office back first, because that was the conversation with the most immediate consequences. And she'd learned early that you handled immediate consequences before you handled the complicated ones. The board had concluded its emergency session at 2 p.m. The outcomes were as follows. Philip Garrett's employment was terminated effective immediately. The termination letter citing falsification of compliance records, deliberate suppression of documented patient safety concerns, obstruction of emergency medical care, and attempted destruction of evidence. The county DA's office had already been in contact with the state attorney general. The state health board had opened a formal investigation that would take months and would, Odom said, go where it needed to go without interference from the board. 2 other senior administrators whose names appeared in the compliance document trail had been placed on administrative leave pending review. The board had voted to retain an interim CEO from an external healthcare management firm, effective the following Monday, with the explicit mandate to stabilize operations while the investigation proceeded, and the board had voted, unanimously, to offer Mara a formal appointment. "We're not asking you to become an administrator," Odom said, on the phone, with the directness Mara had already come to appreciate about her. "We understand that's not what you do, and frankly, it's not what we need. What we need is someone who can build the emergency response capacity of this facility into something that actually works. Trauma training, protocol development, equipment standardization, staff preparation. A program directorship, reporting to the CMO, with the resources it needs to function." A pause. "We should have had this 3 years ago. We're asking now." "I have conditions," Mara said. "I assumed you would." The 14 safety reports. Every item on those lists gets addressed, with documentation within a specific timeline, not promises. Timelines with accountability. Agreed. The blood supply levels get restored to proper minimums today, not next week. That's already done. Doreen authorized the order this morning. The generator coupling gets replaced this week. Decker manages the timeline, and I want to see the completion sign-off. Also in process, a slight pause. Ms. Ellison, we are aware that this institution failed you in specific and documented ways for 3 years. We're not going to ask you to take our word for the fact that it's going to be different. We're going to show you, and you're going to verify it, and that's how it should work. Odom paused again. There is one more thing. Okay? Your complete background, your military surgical training, your service record, the field protocols you developed, all of it is going to become part of your professional record at this institution. Formally. We're not asking you to announce it or make it a story, but we are not going to be an institution that benefits from who you are while pretending it doesn't know. She said this clearly, without softening. You deserve that. This institution needs to be the kind of place that can say it clearly. Mara looked at the window again. The bay. The clean, flat water. All right, she said. Philip Garrett was charged by the county DA's office 17 days later on 4 counts that included falsification of public health records, criminal obstruction of emergency medical services, and evidence tampering. The State Health Board's investigation, which ran concurrently, produced a public report 6 weeks after that, 43 pages that documented the systematic pattern of suppressed safety reports, reduced supply levels, deferred maintenance, and falsified compliance certifications that had characterized the facility's administration under his tenure. The report named the specific dates, the specific documents, the specific decisions, and the man who made them. It was public record. Anyone could read it. The attorney who represented Garrett issued a statement disputing the characterization of his client's conduct. The statement received moderate coverage. The 43-page report received considerably more. The 2 administrators who'd been placed on leave, did not return to their positions. One resigned during the investigation, citing personal reasons. The other was terminated when the review found his signature on 3 of the falsified certification documents. The board member named Richard, who had received the safety escalations and relayed them upward with softened framing, resigned from the board. He released a public statement acknowledging that he had failed in his oversight responsibility and that the consequences of that failure had endangered patients and staff. It was, by the standards of such statements, unusually direct. Mara read it once and did not read it again. James Whitfield came to her office, her new office, a small room off the main nursing station with a window that looked onto the Bay Road rather than the water, which was not as good as the water but was still light, 3 weeks after everything had settled into its new configuration. He knocked on the door frame, which was open, and stood there with the look of a man who'd been composing a conversation for a while. "Come in," she said. He came in. He didn't sit. "I should have pushed back earlier," he said. "Not just last night, the reports, the supply issues. I knew about some of them. I stayed out of it because I told myself it wasn't my lane." He stopped. "That's not an excuse. I'm telling you because you deserve to hear it directly." She looked at him. "I know," she said, "and I know it wasn't easy to say that. Is it enough?" She thought about the honest answer to that, which was that apologies from people who'd stayed quiet while systems failed were not magic, did not undo the years of isolation and institutional resistance, did not give back the night she'd gone home, knowing she'd written another report that would go nowhere. The honest answer was that enough was complicated. "It's a start," she said. "And you were there when it mattered. I know that too." She met his eyes. "Work with me on the training program. That's where it counts from here." He nodded. Something in him released slightly, not all the way, but enough. "Yes," he said. "Absolutely yes." Diego Paredes went home 5 weeks after the storm. The vascular repair had held. The physical therapy had been grueling in the specific way that PT was grueling when you were 23 and had been told you'd recover fully and were now doing the work of making that true. His mother came from Corpus Christi for the discharge, a small, fierce woman who shook Mara's hand in the hospital lobby with both of hers and held it for a long time without saying anything, which communicated considerably more than anything she could have said. Paredes himself, and the particular awkward grace of a young soldier who'd been through something he didn't yet have the full language for, looked at Mara and said, "I told my mom about you." "What did you tell her?" "That you didn't panic." He thought about it. "That you just kept going, like it wasn't a question." He paused. "She wanted to know if that was something you could teach." Mara looked at his mother, who was watching her with clear, assessing eyes. "It's something you can learn," she said carefully. "Whether it can be taught depends on the person." His mother smiled, small and private, like that was exactly the right answer. Morrison was transferred to a rehabilitation facility 40 minutes north, 8 days post-surgery. Sable's repair had done what it was designed to do, and his prognosis had moved from cautious to genuine over the course of those 8 days. And when Mara saw him before the transfer, he was awake and oriented and annoyed about the cognitive assessment protocols in the way that was, Sable had told her, actually a positive neurological sign. He didn't say much. He looked at her with the direct, slightly bewildered look of someone who remembered fragments and was still assembling them. "You drilled into my head," he said. "Technically, I decompressed the pressure," she said. "In my head?" "In your skull, yes." He absorbed this. "Okay," he said. "Thank you." "Don't do anything that requires another one," she said, and he laughed, which was a sound that cost him something still. She could see it in the brief tightening around his eyes, but which was the kind of sound that meant things were working the way they were supposed to work, and that was worth the cost. The formal interview with General Adler happened 6 weeks after the storm, not in person but on a video call, which was its own kind of courtesy. Adler giving her the distance, the absence of physical space to navigate, the ability to be sitting in her own kitchen with her hands around her own coffee mug when she had a conversation that had been 4 years in coming. Adler looked the same. That was the first thing Mara thought, and then she thought that wasn't right. Adler looked like herself. which was different from looking the same, which was a distinction that mattered with certain people. "How are you?" Adler asked. "Better than I was," Mara said. "Worse than I'll be." That's the most honest answer to that question I've heard in a while. Adler folded her hands on her desk. "I'm not calling to recruit you back. I want to be clear about that up front. What you're doing at Garrison Point, I understand why it matters, and I'm not here to pull you away from it." "Then what are you calling for?" "To tell you something." Adler paused in the way she paused when she was choosing words rather than finding them. "The protocol you developed in 2019, the Battlefield Emergency Triage Framework. It's been used on 47 separate operations since it was implemented. I'm not going to give you specific numbers because some of them are classified, but I'll tell you this. The number of personnel who went home to their families because of that protocol is not a small number." She held Mara's gaze through the screen. "You walked away, and the work stayed. That's what I wanted you to know. The work stayed, and it kept working, and it saved people you'll never meet." She paused. "I thought you deserved to know that." Mara was quiet for a moment. Outside her kitchen window, the bay was doing the thing it did on good mornings. The light coming off it in a way that made the whole world look provisional and clean, the way the world looked when you'd been through something hard and were on the other side of it, a little. "Thank you," she said. "I needed to hear that more than I knew." Adler nodded. "Take care of yourself, Ellison. And take care of that hospital. It's lucky to have you, even if it took them too long to figure that out." Rollins was the last of the 6 to be officially discharged from medical involvement, not because he was the sickest, but because the cardiac monitoring protocol for post-tamponade patients required the longest observation period, and because Rollins, in the way of someone who'd learned that compliance was sometimes more efficient than argument, had followed the protocol completely and without complaint, which had actually made it go faster. He was cleared at 4 weeks. He came back to Garrison Point on a Tuesday, not in uniform, but in civilian clothes, the ordinary civilian clothes of a man in his late 30s on a day off. And he found Mara in the corridor outside the newly configured trauma training suite, a room that had been a storage space 3 months ago and was now equipped, properly equipped, with the materials she'd put on the procurement list and Odom had approved within a week. He looked at the suite through the window. She let him look. "How many staff are you training?" he asked, starting with 30, ER and ICU, then expanding to the floors. She looked at the suite too. "The goal is that next time something like that storm happens, this building knows what to do before I get there. Next time you might not be there." "That's the goal," she said. "That's the whole goal." He turned to look at her. "You're staying then, permanently." "I live here," she said. "I've been living here for 3 years. People just didn't know the full version of it." She paused. "I'm not hiding anymore. That's the change." She said it plainly, without drama, because it was a plain fact, and drama would have made it less true. Rollins was quiet for a moment. Then he said, "I owe you something." "You don't." "Not for the medical care, for—" He stopped. Started again, which was not something she'd seen him do before. "At Kestrel. You stayed in that tent for 19 hours. I was evac before the surgical phase, but I read every report afterward, and I know what those 19 hours looked like. I know you lost 2 of my men, and I know what that cost you, and I know that it was part of why you left." He looked at her directly, the way he'd been looking at her since the first night. "I never got to say anything about that. I wanted to." She held his gaze. This was the part of things that didn't have a clean resolution, that didn't close with a report or a board vote or a training program. The 2 soldiers from Kestrel had names, Hendricks and Park, and she knew the names the way she knew all the names, the way certain things lodged in the specific geography of a person and didn't move. "You don't need to say anything about Kestrel," she said. "You already sent the recordings. That was you saying something." He considered this. "That was operational." "It was both things," she said. "It can be both things." He nodded, once, the nod of a man accepting that. "Carrillo's daughter," she said. "Rosie." Something crossed his face, swift and unguarded. "You remembered. You told me about her in Base 6 at 1 in the morning. Yes, I remembered." She paused. How is she? 3 years old last month, he said. Obsessed with dogs. He paused. Carrillo sends a picture every few months, to the team. She nodded. Let that sit for a moment between them, the particular weight of it, the small, ordinary life of a child born because a surgery held, because a night went the way it needed to go, because someone stayed in a tent and did the work that needed doing. Good, she said. That's good. He left 20 minutes later, the way he'd come, without ceremony, without an extended goodbye, the way people left when they were fundamentally practical. She watched him go down the corridor and out through the main entrance, and then she went back into the trauma training suite and looked at the equipment and the protocols on the wall. Her protocols, the ones she'd written and submitted and revised and finally been given the resources to implement. And she let herself feel, for a moment, the full weight of what the past 8 weeks had been. Not triumph. It wasn't triumph. Triumph was clean, and this wasn't clean. There were still 2 men from Kestrel who weren't anywhere, and there were 3 years of reports that had gone nowhere. And there were staff members at this hospital who'd watched things happen and said nothing. And the board member named Richard had resigned, but he'd also sat in rooms for years and softened the language of safety escalations. And some of those things resolved clearly, and some of them just became part of what you carried. That was the reality of justice as it actually existed, as opposed to justice as people needed it to be in the versions of stories that made them feel better about the world. Real justice was specific. It named people and dated documents and carried consequences that were measurable and real. It also didn't erase what had happened before it arrived. What she felt was something more honest than triumph. It was the feeling of being fully in the place you were in, without apology and without concealment. The specific solidity of not having to translate yourself into a smaller version before walking into a room. She had been doing that translation for 4 years. The energy it had taken was something she understood now, fully, only because she wasn't spending it anymore. She picked up the first protocol binder from the shelf. She'd written the emergency airway management section herself, drawing on the military field manual she'd helped develop and adapting it for a civilian hospital context, building in the resource limitations that civilian ERs actually faced rather than the idealized conditions that most training materials assumed. It was practical in the way things were practical when they'd been written by someone who'd done them in a tent during a mountain storm with inadequate equipment and no backup. The first training session was in 3 days. 30 staff members, 6 hours, scenarios that would be realistic enough to be uncomfortable and realistic enough to build the kind of muscle memory that didn't abandon you when things got bad. She designed the discomfort deliberately. Comfortable training produced comfortable responses, and comfortable responses killed people when the situation stopped being comfortable. Doreen appeared in the doorway. She looked at the binder and at Mara and at the suite, and she had the expression of someone who'd worked alongside a person for 3 years and was now seeing that person in full for the first time, not with surprise exactly, but with the particular satisfaction of a thing that had been out of alignment for a long time finally settling into place. The new generator coupling is in, she said. Decker just signed off on the installation. Good. Blood supply is at full minimum plus 20% buffer. Good. The interim CEO wants to meet Thursday, and there are 2 nurses from the county hospital who've asked about the training program. Apparently word got out. Tell them Thursday works for both things. Mara set the binder back on the shelf and looked at Doreen. And tell them to bring their most experienced people. I want the staff who've been doing this the longest, the ones who know where the gaps are. She paused. They always know. Nobody asked them. Doreen smiled. A small, private thing. I'll tell them. She left. Mara stood alone in the training suite for a moment, in the quiet. She thought about the question Paredes' mother had asked, through her son, through the translation of a brief conversation in a hospital lobby. Whether it was something you could teach. The steadiness, the not panicking, the quality of continuing when everything in the environment was telling you that continuing was not possible. The honest answer was that she didn't know if it could be taught. She knew it could be learned because she had learned it, not in a classroom, but in rooms a lot like this one, in tents that smelled like blood and rain, in moments when the gap between what she could do and what the situation needed closed to nothing, and she had to decide every time whether she was going to close it or let it stay open. She had closed it every time. Not because she wasn't afraid, She'd been afraid many times, more than she'd ever told anyone, but because the alternative was the thing she'd found unacceptable, and that finding was deeper than fear, rooted in something she didn't have a word for and didn't need one. You couldn't teach someone to find that thing, but you could build systems that gave them time to find it themselves. You could build protocols that reduced the chaos to manageable problems. You could train people until their hands knew what to do while their minds were still catching up. You could create the conditions in which ordinary people could do extraordinary things, because the truth she'd learned, the thing the past 8 weeks had confirmed in a way that nothing else could, was that extraordinary things were not the exclusive province of extraordinary people. They were what happened when ordinary people were given the tools, the preparation, and the leadership that let them show what they actually had. That was what she was building here, not a monument to what she'd done on one bad night. A structure that meant the next bad night would go differently regardless of who was in the building. She turned off the light in the training suite and walked back out into the corridor, and the corridor was what it was. The ordinary, urgent living of an emergency department, people doing their jobs, the monitors at their stations, the smell of coffee from the break room, the automatic doors opening onto the bay road where the afternoon light was coming in flat and clean off the water. And she was part of it, unremarkably, the way you were part of a place when you'd stopped pretending you weren't. Her badge was on its lanyard. She'd started wearing it again the day after the board meeting, not as a statement and not as a declaration, just because it was hers and this was where she worked and that was the whole story. She clipped it to her pocket and went to check on her patients. Not because someone had told her to, not because she was proving something, because there were people in those rooms who needed someone to show up, and she was the person who showed up. And she had always been that person, and she was done apologizing for it. That was the thing about being seen, finally, accurately, in full. It didn't change who you were. It just meant you didn't have to spend energy on the distance between who you were and who you were allowed to be. That energy came back to you. You got to use it for the actual work. And the actual work, as it turned out, was more than enough.